position at the state. They didn't have someone who was overseeing some of these things. So when I arrived, I think my first week on the job, I was sent to a conference, a broad injury conference, but I was told to go sit at this one table that was talking about poisonings, and I had no idea what they were talking about. And I think I had the general conception that a lot of people had, which is, Drano under a sink and, little kids getting into bad things. And, from that table, obviously the conversation was around the epidemic of prescription and drug overdose. And, we walked away from that thinking that there's clearly a problem. The evidence is really compelling. It's been increasing. If this was probably any other thing, it probably would have gotten a lot of attention, but for whatever reason, the overdoses weren't getting the attention they needed at that time. So there was a huge problem, and there was a bit of a response, but it wasn't, in terms of the scope of the response, it didn't really match the need at the time. And it still doesn't, to be quite frank. So in 2008, when I took over as the injury epidemiologist, the epidemic was clearly in full swing. It had increased from 1999 about fourfold, from a little under 300 deaths to over 1,000 deaths. At that time, again, I think people recognized the surveillance and the public health issue of it being a problem, but they hadn't recognized the resources needed or what the programs would be or interventions that would be effective. And so, at that time, there was just more or less the data that was saying, hey, we've got this big problem, and it was really looking to try to figure out what the response would ultimately be. Clearly the epidemic has continued to the present day. For most of the states in the nation, it now exceeds motor vehicle deaths. North Carolina, the unintentionals are still a little bit lower than the motor vehicle deaths, but if you look at all poisonings from all types and all intents, it exceeds motor vehicle, and it's around 1,200 deaths. A little close to 1,000 of those are prescription or drug related.